glad to have you on our program, and I'd like to start with just introducing yourself to the audience.
Yeah, thank you for having me. I'm a UX researcher and designer, a healthcare blogger, a public health and wellness advocate. I've also worked in several healthcare sectors, from literally starting as a patient service coordinator, checking patients into the Epic EHR for their appointments, all the way to working with innovative health tech companies on their user experience.
That's a great way to start us off with this session and to kind of get into the nitty gritties of the topic with the health technology and the impact on healthcare access and equity, as I know you're passionate about. How has the introduction of health technologies impacted the overall accessibility of healthcare services, especially in underserved or even remote areas?
So obviously, from an optimistic perspective, health technology has created pathways for people that didn't previously exist. Not only has it connected people to healthcare professionals, but it's also connected people to health information. And even sessions like this, you can find resources, communities, chat groups, essentially, for just about any health concern or condition that you have today. And I think that increase in the connection to community is in itself an increase in accessibility.
And can you elaborate more and provide some examples on the specific health technologies that you have seen successfully address disparities in access to care, and how do those technologies work?
Yeah, so one company that I cannot say enough great things about is Health and Review. They empower Black women and women of color to advocate for themselves in healthcare settings while also connecting them with culturally sensitive medical providers through their platform, which I think is awesome. I think it's overdue, quite frankly, but it's an incredible organization. And I think they've even, as far as accessibility, they've even provided about 200 memberships to residents of underserved communities within Minnesota, as an example. And even the community conversations that I've had the opportunity to moderate provide virtual access to healthcare resources, topics, and providers.
Oh, well, that's great that there is starting to finally be, more availability and technologies and resources to help really be able to address, the disparities, especially in the rural areas and underserved areas. So that's a great example that you provided. And, on the topic of still trying to provide more, health with technology to these areas, there is challenges that arise as barriers with the adoption of health technology, particularly in relation to health equity in healthcare. Can you kind of talk about what you think are the most important or biggest challenges that we have to overcome?
Yeah, so the number one thing that always comes up for me is cost. As an example, wearables are extremely convenient, but unfortunately, they aren't always equitable in the sense that they're not necessarily always affordable. And a lot of these wearable technologies that could be supporting the people that most need them in these underserved communities or those that are disproportionately impacted by health disparities aren't necessarily covered by insurance. So even if you do have insurance, you're not always going to have the affordable or the affordability or that accessibility that you would need to even utilize these types of technologies. And that's simply because the American payment model just isn't there yet. Hopefully we see changes and improvements with that, but I also did want to talk about how a lot of these big health tech companies target the masses. And that makes sense. But at the same time, we also know that it's no secret that traditional healthcare was not necessarily designed for people of color. It's incredibly biased, and people of color are much more impacted by these health disparities than any other group of people. Using a very basic example, something like BMI. If a health technology or a wearable is built to assess BMI and then make care management recommendations, the people that are developing these technologies and those recommendations need to be aware that the information that sometimes gets used to inform those recommendations can be inherently biased or racist. That's something that I think about every day when I'm working in research and design. You want to make sure that you're always designing for the consumer and always using information to inform technology that is designed for that consumer.
No, I love that. Definitely, we need to focus to be more inclusive and consider everyone when developing anything within the healthcare space. And kind of turning the conversation a little bit to, I wanted to get your opinion on telemedicine and especially remote monitoring. Do you think that these have improved or worsened disparities in terms of access? And do you also think that there have been certain populations that are unfortunately disproportionately affected?
Yeah, so I'm going to give the answer that most people hate. It depends. So I think affordability is one aspect, which I touched on, but also consumer trust is a huge risk to telemedicine's availability and ability to expand access. So in terms of trust, some of the user research that I've done related to consumer opinions on things like virtual health reflect that there is still some level of mistrust in the physician's ability to assess, diagnose, and then treat them virtually, in addition to what's actually being used with their health data, which I think some of the other speakers have touched on previously.
Yeah.
So although we're passionate, we being those that are working in health tech, and knowledgeable about telemedicine's potentials, the people that we serve aren't necessarily as knowledgeable or as trusting. So I think education is definitely part of increasing some of that accessibility and adoptability, but also messaging and communication around the potentials of those technologies and then what we're doing with consumer data.
And do you have any recommendations for being able to spread that education? Do you think that there is more collaborations that we need between healthcare providers and community organizations so that they can, number one, spread the education and awareness, but also effectively address the different healthcare disparities that exist?
100%. I think partnership with community organizations, especially organizations that are already trusted organizations within the communities that we're targeting, are extremely important. If we're working in silos like healthcare traditionally does, I think that that kind of prevents us from progressing as much as we could.
And have you seen any successful collaborations that has addressed these issues?
Yeah, so I think honestly, healthcare insurers are doing a much better job at tapping into the communities that they serve. A lot of these health insurance providers operate on a state to state basis. So I've seen efforts to kind of go into the community and be more like patient or consumer facing and not just that payer on the back end, which I think is really important.
And I wanted to get your thoughts on this as we kind of wrap up this session just a little bit in terms of data privacy concerns. So how can data privacy concerns impact equitable use of health technology? I'm kind of going back a little bit to that trust factor. And what steps do you think can be taken to balance the privacy with improved access to care?
Yeah, so I mean, obviously not using predatory practices and taking advantage of users. I think it's especially important in health technology not to do that because these are vulnerable people. This isn't necessarily like social media, which is still, we shouldn't be using consumer data inappropriately. But something like health, I think once that trust is broken with our consumers, it's really hard to get it back. Also, people are at their most vulnerable. So I think just becoming a trusted source as far as data privacy and then communicating with our consumers how and why we're using the data that we're collecting is extremely important.
Definitely. And just to add one last quick question here to wrap this up, in terms of the use of social media, I know that others like yourself are promoting healthcare and awareness online through social media, and it can be a very useful and impactful tool. But do you think there are also concerns with social media, and where do you find that balance?
For sure. I think social media, the good in it is that we have a lot more access to people with information. But at the same time, there are people that are not necessarily experts spreading misinformation, and misinformation in healthcare. Not only is it becoming a bigger concern, but it's also, I think it kind of pulls us back from a lot of the progress that we've made in healthcare and in the spread of information and access to information. So just being a trusted source, but also making sure that people are aware of the sources that they're following.
Mhm.
I think that's extremely important. Now anyone can be an expert just jumping on social media and talking about it. There's good and bad in that, but yeah, just making sure that you're following people that are credible and that have like are pulling the information that they're sharing from credible resources.
Right. No, thank you so much, Sydney, for sharing all your valuable insights, especially with that social media portion, because, there is definitely a fine line there and where to balance it. And especially with the public health background, we are always taught, make sure you trust your sources and make sure it's a trustable and reputable source before you ever take any of that medical information.